Hi everyone, Sarah Rudolph with Vital Life Physical Therapy in Longview, Texas here. I had a friend of mine contact me recently and ask me for some advice as far as what she could do for her sciatica. Now this friend happens to live over the pond in Portugal, so I thought it would be easier to just do a quick video to address the issue rather than trying to write her out a whole paragraph or two over Facebook. So, Leanne, this is for you, and I hope it helps for you. If you see me looking up to this direction, it's because I have some notes written down as I was thinking about what I was going to say. Have a little whiteboard there, which I was going to put before the screen, but most of my dry erase markers are not working very well, so it didn't look very pretty. So what is sciatica? In the profession that I am in, physical therapy, a lot of times I hear people saying, oh, I have sciatica, or I'm sure you've just heard in the general population, people referring to the fact that they have sciatica. There's a general prevalent thought out there in the general public that if you have pain down your leg, you have sciatica, which people think means that your sciatic nerve is irritated for whatever reason it might be. Whether you have something going on in your back to have caused irritation on the nerve or what have you. So I'm not dispelling the fact that some people do have true sciatica, but there is also another common syndrome which can be very easily confused with sciatica, and that is piriformis syndrome. So true sciatica, the pain tends to go all the way down the leg from the buttock all the way down into the foot, and it is caused by the nerve roots being irritated, where the nerve actually exits the spinal cord. If there's a bulge from one of the nuclei from the discs, it could be pushing on the nerve, or sometimes you have some arthritis and stuff that's built up around there, which could be irritating the nerve root itself before it even gets into the leg. And then, of course, you have this piriformis syndrome. And the way that piriformis syndrome happens, or why it happens, has a lot to do with the orientation of the piriformis muscle and the sciatic nerve in the pelvis, actually. So I have a little diagram here I'm going to put up before the screen so that you can see a little easier. Got a hold of one of my old anatomy books here, so it's not very pretty, but I'm going to try to show you. Okay, so right here we have the piriformis muscle, and this thing right here is the sciatic nerve. Okay, so in this picture, the sciatic nerve is actually underneath the piriformis muscle, which comes from the inside part of the sacrum and then goes through the pelvis and attaches to your femur. And in some people, this sciatic nerve here actually goes right between the fibers of that piriformis syndrome, of the piriformis muscle, excuse me. And so you can easily understand that if you have tightness in this piriformis muscle, and especially if that nerve is running through it, the tightness in that muscle is going to be contracting and putting pressure on that sciatic nerve. And so that can easily cause pain into the nerve as well. So it doesn't only have to happen in people where the nerve actually bisects that piriformis muscle. It can also be the piriformis can have trigger points, which just makes it tight anyway, and so it can push on that sciatic nerve even if it's going underneath the piriformis muscle. And then also sometimes the piriformis muscle can actually be on stretch because of a malalignment in your pelvis, which then changes the orientation of your femur bone in relation to the pelvis. And then that can put that piriformis muscle actually on stretch, which can also then cause it to be putting pressure on that sciatic nerve. So it is important really to be able to get a diagnostic from a physical therapist who can do some tests to rule out for you whether it would be true sciatica or piriformis syndrome. Most cases in the piriformis syndrome, you may not get the pain all the way down the leg, but again, it depends on how much that nerve is being compressed by the muscle. That you can also just have trigger points in the piriformis muscle, which can refer pain down into the back of the leg as well. So a physical therapist can also check on the alignment of your pelvis, and many times if that is out, they can show you ways to correct it, and they can assist you in correcting it when you see them in their clinic. And that can also greatly reduce the strain or the stretch on the piriformis and subsequently the strain on the sciatic nerve. So again, my advice would be definitely seek out a physical therapist who can give you an assessment and give you some practical guidelines from there. So I'm going to just give you some very generic things that you are welcome to try at home. Of course, when you have a muscle that's tight, they normally like to have some heat on them because that helps them to relax. So using a heating pad or a bean bag that you warm up in the microwave and just putting it on that hip area will help to relax the piriformis. And then again, my handy self-treatment balls, which have a little bit of give to them. And I prefer to use these rather than a hard lacrosse ball, softball, baseball, stuff like that, that doesn't have any give to them, because your body really resists something that is hard and doesn't have any give. So you would take the self-treatment ball and put it underneath the fleshy part of your hip when you are lying down. So I'm going to just change my screen a little bit and demonstrate this for you. Hopefully my iPad is not going to fall over here. Okay, I think that'll be good. Okay, so when you're using the self-treatment ball, you want to put it up in that fleshy part of your cheek over there. Okay, and what you can do is sort of roll around on it a little bit to find that spot that's most tender. Obviously you're going to be lying flat like so, and you can start off with the leg flat if you like. Now that for me is much less pressure, so bending the knee up really gets a little bit more pressure onto the ball. If you find a place that's really too tender, then just move the ball a little bit off of it so that it's kind of partially still on that tender and tight area. And then you just want to take some deep breaths and settle down on it. So you roll to find the spot, and once you've found it, you're going to settle down on it. And if you want to increase the intensity, you can slowly let that leg where you have the ball under the hip, let the leg come outwards. And that generally increases the intensity right there. So again, if that's too much for you, you don't want to do that, okay? And you do want to try to hold this position for at least about 3 to 5 minutes to allow those muscle fibers and the fascia time to release and let go. And then what you can do once you've done that, you can do that on a couple of different spots around that hip. And then there's a couple of stretches that you can try. So bringing the knee across towards the opposite shoulder usually gives a pretty good stretch in that area exactly where the piriformis is. And if this is too intense for you, again, you can back out of it. You always want to do a stretch to where you feel some stretch, but it's not so intense that you cannot relax into it. So you want to be able to hold this stretch again for about 3 minutes if possible. And just think about lengthening. Wherever you feel that tightness, try to envisage those fibers lengthening and releasing. And come out of your stretch slowly. Also, you can do the figure 4 stretch where you cross that ankle over the opposite knee. For some people, this position is already enough. Some people like to push the knee out away from them. And then some people like to bring that other leg up and hold it with the hands. Now you can either relax this leg or you can put the foot up to where the knee is at 90 degrees. And that for me also increases the stretch in this hip right here. Okay, so this is the figure 4 stretch. Your legs make a figure 4 right here. Again, you want to hold that for a minimum of 90 seconds, but preferably longer, to allow these muscle fibers to release, and then you're slowly going to come out of it. Okay, you can also do the rotation stretch, which I showed on a video a couple of days ago. And again, if any of these bother what you're feeling in your leg or they cause increased intensity, you really need to seek out the help of a trained physical therapist. A couple more things though that you can do to help yourself is to really just work on your postural alignment. So a lot of times weak abdominals cause us to have increased curvature or lordosis right here in the lower back, and these lower back muscles are really, really tight, okay? And that again can just perpetuate the symptoms that you're feeling. So you really want to work on just those core deep abdominal muscles by pulling in the belly when you're doing any kind of standing, any lifting, any kind of activity. You want to try to engage those muscles so that you can release the strain on the small muscles right down along the spine. And that'll also help to improve your pelvic alignment, because most of the time when we have weak abdominals and we have tight here, we're like this, and that tips the whole pelvis forward, which then can increase the stretch and the irritation on that sciatic nerve. So again, no sacral sitting, okay, which is kind of like this, or arch, okay. You want to just have a neutral pelvis right there, okay. So those are a couple of things that you can work on. And then one final one, you know, if you are having a bad day and you just are having a lot of pain, just a great relaxation position is lying flat on your back with 1 or 2 pillows up underneath your knees, and that'll help to just relax the pelvis and relax the low back and take the pressure off of that nerve. And the reason why we put a couple of pillows in is a lot of people have a little bit of tightness in the front and that lordosis, that increased arch in the back, and a little bend in the knees with a couple of pillows so that you can be a passive bend will just help to relax everything through here and hopefully ease any pressure that is on that nerve if you have true sciatica. So once again, get a consultation with a local physical therapist. And if you're here in the Longview area and you have any further questions, or these symptoms that I'm speaking about today resonate with you, it's something that you've been battling with or a friend or family member is, and you want some diagnostics to be done, feel free to contact me. Many people don't know that you can actually see a physical therapist without having to go to the doctor first. And so we can do a full assessment and help to get to the bottom of your problem, and then work out a course of treatment that can help you get some alleviation from your pain. So Leanne, I hope that helps. And anybody else local, if you have other questions, feel free to contact me. Again, this is Sarah Rudolph with Vital Life Physical Therapy in Longview.